Over the last several decades, obesity has been recognized as a major medical problem. It causes other medical conditions such as high blood pressure, diabetes, high cholesterol, sleep apnea, and a host of other problems. The degree of obesity that can cause these problems in a particular patient is different depending on the individual. As surgeons, we use a number of criteria to determine who is a good candidate for having a weight loss operation. The most obvious of these is weight. If the patient has a body mass index of 35 or 40, then probably they are looking at a lifetime risk from their weight that is higher than the risk of an operation, and therefore they would be a reasonable candidate. Weight is not the only thing that should be taken into account. Family history is very important. If the patient has had a family member who suffered a heart attack or a stroke, or is dealing with high blood pressure or diabetes, then they too probably are at increased risk relative to other people who do not have a family history. Of course, associated medical conditions are also important and increase risk. High blood pressure, diabetes, high cholesterol, and sleep apnea are all independent risk factors for heart disease, for hardening of the arteries, for heart attacks and strokes, and early death. I frequently have patients come into my office who've been struggling for years with their weight. They've done diet after diet, and they've seen some results, but they tend to gain the weight back at some point. This is one of the great problems with medical treatment. Frequently, patients become frustrated because they put in the exercise or they change their eating habits and they don't see much results. In addition, year after year, patients will lose a small amount of lean muscle mass, and this will reduce their basal metabolic rate. This makes it harder to lose weight as patients get older. A typical patient I see in my office will have a number of medical problems for which they're taking medication, and they are slowly gaining weight over time. They've already seen family members deal with medical problems related to obesity or have a catastrophic event such as a heart attack or a stroke. Frankly, many of them are scared about their futures. I can tell them with a high degree of confidence that a bariatric operation will result in a significant decrease in their weight. In addition, if they have other medical problems related to their obesity, those problems will likely be cured or much easier to control. They can come off many of their medications and they feel better in general. Bariatric surgery reduces significant long-term risk and has been shown in a number of studies to increase life expectancy. Deciding when to have an operation is an intensely personal choice. I think it is important that the patients become as educated as they can on the disease process and on the treatments available. If you have any questions, you should sit down with an experienced bariatric surgeon and go over your options.